You're listening to the podcast between doctors and friends. Welcome to another Sunday of Between Doctors and Friends. We have with us our usual Dr. Ray, an OB-GYN uh, doctor. Say hello, Dr. Ray.
Hello, everyone. Hope you're doing well.
And then we have Dr. Foz, the doctor of everything. Say hello, Dr. Foz.
Hello.
How are
That's
we?
how you should introduce us. Like Dr. Ray, the doctor of women's private parts, and Dr. Foz, the doctor of everything.
Well, Dr. Ray, the doctor of women's parts, but don't you deal with like also hormones and all that crap?
Yeah, but that's all like affecting women and their private parts. So yeah, we do a lot of menopause care, a lot of that because it affects the women, not only systemically with like the hot flashes, mood swings, irritability, but it affects, vaginal dryness, frequent UTIs, pain with intercourse, vaginal itching, so all of that.
And then Dr. Foz, I even called Dr. Foz for like dog stuff this week. So,
Hence the doctor of everything.
doctor of everything. What do you think about that, Dr. Foz?
Yeah, the amount of times that I feel like I should say I don't know is higher than you would imagine.
Do you start your day like, or not start your day, but when you see a patient, I'm like, come on, bring it on. Like, what are we going to have next?
Well, it's the hard part, I think. One gripe I have, right? So I'm going to just turn this into Dr. Foz's gripes today.
All right.
Or what do you mean today? Every day. Is like you walk into the room, you have like, 15, 20 minutes, whatever is allocated for your patient visit. And you walk in there and it's supposed to be about, I don't know, their diabetes management or their blood pressure management or whatever. And then it spirals into something else. Like it's always at the last minute. It's like, oh, by the way, I know that we just spent like, 12 of these 15 minutes talking about how my diabetes is poorly controlled and, why we're arguing about why you should be on a cholesterol lowering medication, but you don't want to take it. And at the last minute, you're like, I've been having this shortness of breath.
Oh boy.
Oh my God.
Right. Those are what we call the door handle questions, right? As soon
Well,
as we're
it's like, why did you wait till and I'll even
Yeah.
ask patients, why did you wait till right now to say this to me? Because this is a
Yeah.
serious evaluation.
Yeah.
And they'll be like, I forgot.
Oh
Yeah.
wow. So
And
anyone
then,
who's listening out
and then
there,
I'm
like,
mad. And then
okay,
I'm
so
mad. I'm like mad at that point.
oh wow, that's good to know.
Yeah.
Um,
Well, it's usually what the real reason of the visit is, and they're hesitant to bring it up, maybe a little embarrassed to bring it up. And they come in for maybe other reasons, and we talk about all those other reasons. We spend the whole visit talking about it, making a plan, giving medication, everything. And then when I say, all right, any more questions? They usually say no. And then I get up to walk out. I put my hand on the door handle and they're like, oh, by the way, I've been bleeding straight for 30 days. Or, what can we do about menopause? Or some complicated question that I'm like, that's not something that we can answer very quickly. That's a whole nother 10-minute conversation, So it is a little frustrating because we've sort of, it's like bringing your car to a mechanic shop and saying, I need an oil change. And then when you're, paying the bill and wrapping everything up too, just saying like, oh, by the way, I also need 4 new tires, and they're like, well, we kind of just finished you and we're done. We're starting to work on the next person. So, I usually, address it. If it's urgent enough, then I have to close the door, sit back down again, and address their issue because it's urgent or important enough. If it's something that could wait, then maybe I'll tell them, this deserves a much more, directed conversation. And why don't we have you come back and we can talk about that a little bit more in depth and in detail.
And then they get mad. They're like, "But
Yeah.
I don't wanna do that. I'm already here. I don't wanna pay another copay." And you're like, "Dude, I
Yeah.
have 2.5 minutes to go into something," like, and then you're like, "Okay, you've been short of breath." "Well, how long have you been short of breath?"
Right.
And I have patients where I ask them that. I mean, if you've been short of breath for 2 years, that's less urgent than you've been short of
Right.
breath for a couple of days,
Right.
And then sometimes trying to just get that information so I can triage just how serious this is. I've literally told patients, "Okay, I've asked you this question 5 times. I just need
Yeah.
an approximate answer.
Yeah.
2 minutes, 2 years, 2 days, 2 weeks. How
Yeah.
long has this been going on for?" And even in those, you're just like, "Oh my god, you don't have any." This is a doctor's office visit is the only kind of meeting that comes together with 0 agenda.
Right.
Outside of, I have an agenda, but you have a totally different agenda and you're gonna try to control it. And I'm like, I have people who are waiting. And so that's why people get mad, like, "Doctor's late." Well, because we're doing the best we can with
Right.
people who can't communicate to save their lives.
Right, or who bring very complicated issues in, and maybe they scheduled it differently. Like I get the thing where they schedule their well woman visit, and a well woman visit, much like a well child visit should be, you're perfectly fine, you have no issues going on, you're just here for a preventative care evaluation. You're getting a breast exam, you're getting a referral for a mammogram, you're getting maybe your pap smear done, maybe a pelvic exam done, questions about, immunizations and vitamins and medications and, just general health stuff that should be about let's keep you healthy for this next year. But they come in as a well woman exam and then they start complaining about multiple problems and issues. And now they've turned it into a problem visit where I've scheduled you just for a well woman, which usually will take, 10 to 15 minutes. Now this is a problem visit that's going to take a lot longer. And so the next patient, then that goes into their time. So, when patients don't schedule their visits appropriately, then we can't stay on track on our time. So it does make it more challenging.
How do we solve this? I mean, I don't think people know that they only get a max of
You know what I think
15,
it
20
you know what
minutes.
I think it is? I think
Mhm.
it's because people are just really selfish. They don't, you know what I mean? It's like, and
Yeah.
they wanna argue with us. It's like, "Hey, I just spent, 12 and a half of 15 minutes trying to make sure that, okay, let's just use diabetes as an example. Like, everything is well controlled. You understand why these meds need to happen or why we should stop this one and what needs to happen. And I've already planned for your next set of labs. And like, okay, and I happen to also flip through your chart while we're talking. I'm like, oh yeah, your colonoscopy is overdue. Let's get that going. And so I'm also filling out referrals for other stuff for your health while you're blithering at me about something that I'm trying to also figure out. And then you're like, "Oh, hey." And then it's like you don't have any concept of like the appointment's over. I am doing the best I can, but I even walk in like, like Dr. Ray was saying about preventive visits, like I'll walk in, a preventive visit is to prevent problems. It's not to work up and evaluate new problems. And that's also like an insurance thing. It's
Yeah.
an insurance and billing thing, like, and that I can't control. That's your
Yeah.
insurance company. If I don't cover certain things during a preventive visit, then it's not a preventive visit. And if you address new issues that I have to evaluate and work up, then that's going to be billed separately because that's not part of preventive visits. And so now people are mad. So like
Yeah.
if you're coming in, I'm trying to do your preventive visit and then we've got your vaccines and I've told you to go see your dentist and your eye doctor and we've ordered your mammogram and all this stuff and then we've touched on and I in those visits, I will touch on their current issues, like, "Hey, you have thyroid disease. How's the meds going? Okay, we'll be sure to throw in a thyroid test in here." And then, um, I'll couch what I can as a preventive visit, I'll do the best I can. And then it's like, "Well, I have this list of things," and they bring out a list of, like, 10 things, and you're like, "Okay, well, what's on your list?" And they're like, "Well, the first one is." I'm like, "Okay, can you just tell me what's on the list so we can prioritize?" "I will. I wanna talk about this one first." And you're like, "Okay." And then they'll talk about, like, their toenail fungus and this rash, and my scalp has been itching. And then at the bottom, they'll be like, "And I've been having this chest pain and rectal bleeding." And you're like, "Oh, wait a
Yeah.
minute. Like,
Yeah.
it's almost like, hey, have you never been to a doctor before? I think you have. Like,
Yeah.
I've known you for the last 5 years. We've been doing
Yeah.
this for a while. So
Yeah.
it's like, I don't understand. It's like, hey, and then when you tell them, look, if I address these things, it's gonna be billed separately. Now I'm the criminal. It's like, hey,
Yeah.
that's your insurance company. I didn't ask for this. And
Right.
I'm happy
Because
to bring you back. And then they're mad about that. I'm like, I
yeah.
can't fix everything today. My whole career was not set aside to meet with you
Yeah.
today to take up 3 hours, and they don't care about other people. They don't
Yeah.
care that everybody's angry at me because I'm trying to frantically get through this.
Yeah. And I don't know. I assume it's the same with primary care annual physicals, but like an annual well woman exam usually doesn't have a copay with it because it's considered a preventative care visit that your insurance company wants you to do so that we can identify and address issues before they become problematic. And once I talk to the patient and say now she wants to discuss the fact that she has pelvic pain or something. And then now I have to address the pelvic pain, and maybe I'm ordering ultrasounds and blood tests and urine analysis. Then now it's coded differently. It's not coded as a preventative visit, it's coded as a problem visit. And now she will have a copay to pay for that visit. And she may have a deductible, and she may have, all the other payments that go along with it. And then they get mad when they get that bill in the mail saying that, like, no, I came in for my annual. I shouldn't have a bill for my annual or a copay for my annual. But we also addressed non preventative care issues during that time. And so I have to document that we talked about it because I have to document what tests I ordered and why I ordered them. And so then that triggers your insurance company to bill it as problem, not
Yeah.
preventative.
If I do something, I mean, if somebody says, "Hey doc, I've got this little itchy rash on my knuckle and I think it's getting better with some lotion. Should I do something about it?" If I call this friendly advice. I'm like, I kind of
Yeah.
briefly look at it. It doesn't look like anything bad. I'm like,
Yeah.
since it's getting better with what you're doing, just keep doing it and let me know if it
Yeah.
come back if it doesn't get better. That's like what I call friendly advice. But
Yeah.
that's I'm not going to bother to document that because it's so minor, and it's not really worth either one of our efforts.
Yeah.
But I always make it clear to the patient, like, hey, if it changes, you come back. If it doesn't go away, come back. Like, I'm happy to help you with more information. But if I have to like order a test, if I have to exclude something dangerous, if then I have to document what I told you and
Yeah.
what I'm going to do about it. And then that gets billed. I don't choose that. I can't order anything without putting in an ICD-10 code, right?
Yeah.
So,
Yeah.
like, I can't just like write a prescription and be like, here you go, because I have to tie everything I give to you to a diagnosis.
Right.
And if you're coming in during a preventive, well adult checkup visit, and I have to then like, treat even something as simple as like, your acne or something, like I can't in order for me to give you that prescription, I have to tie that to that code. And once
Right.
it's tied to that code, billing gets it. And then
Right.
billing's like, oh, acne is not part of a preventive visit. So now you have a preventive visit, which was free, and like an office visit repeat short, and now you have to pay your copay.
Yeah. What
So
do you
like a
do
lot of
with
places. Mhm.
what do you do with refills? Because sometimes I'll have patients for their well woman visit, and they just need refills on their birth control pills or refills on their menopause medication. So usually I just put that under the well woman visit. I don't
Me
code
too.
separately for that. Okay.
Me too. I
Yeah,
try to
but
I try to like,
yeah,
under the heading of well women or
yeah,
whatever, it's like
yeah.
I'll just put,
But if
OCP is
it's a
well
new
tolerated,
problem,
continue.
if it's a
Yeah.
new problem and a new prescription, then I code that as separate new problem.
Yeah. I try to do what I can to give the patient a
Yeah.
break. Like I totally get it.
Yeah.
I want to help you. I don't want you to have to pay for anything.
Yeah.
I'm a patient too.
Yeah.
But
Yeah.
like, come on, give me some mercy here.
Yeah. Yeah, no, I mean, insurance is
I
is
see
really
our
expensive.
hosts smirk.
The insurance is really expensive. I mean, I'll try and do that too, but if it gets too complicated and it takes too much time, then I have to code it differently. So,
Yeah, and people do things like if you give people a break, they expect you to continually give them a break.
right. Right.
That's the other thing too. I'm like,
Yeah.
I look, I've done the best I can for this. I
Yeah.
can't do this, and it starts to look like fraud.
Yeah.
Okay,
Yeah.
from a
Exactly.
patient's point of view, I
Yeah.
mean, some patients will, they'll wait until they see their doctor and kind of collect all these
Well,
questions,
yeah, because they don't wanna come in because they don't wanna pay their copay. So they
right?
save it saying, "I have this free, audience." But sometimes it gets to be so big. I had a patient not too long ago, had so many serious issues regarding some labs that we didn't even get to the preventive. We had labs beforehand, and I'm like, "Look, we'll just talk about this when I see you." And then we get the labs, and they were janky. And then we spent so much time talking about them, like, I hardly got to the preventative. I was like, "Oh my god, like, I can't." I
But do you
Yeah.
think this is more of the insurance issue than the patient issue because
No, I don't
patients
think
don't
it's just
know?
insurance. I don't think it's just insurance. I think
Okay.
it's just because of issues. I mean, the insurance certainly has played into that. Like the whole free physical thing is really stems from the ACA, right? From Obamacare, like where you were
Mhm.
entitled to a everybody's entitled to a free preventive checkup every year where they can't bill you. Um, so that's where that comes from, but people then also, well, I have free access to my doctor, so I'm just going to do everything right now because I don't want to have to come back and I don't want to have to pay for anything. And it's not always just a cost issue, it's often a convenience issue. You
Yeah.
know,
Yeah.
I totally get it, but like I can't, Rome was not built in a day.
Yeah, but maybe like the people I don't know who communicates this to patients that you only get
Well,
like 15, 20 minutes. I mean,
It depends a lot on the structure of where you work. Like
uh-huh.
one place that I worked, there were signs everywhere, like there's posters. If you talk about anything else, it's not a preventive visit. And so then you would have patients where you're like, so how is the whatever? And they're like, am I allowed to say anything? Because I don't want to get a bill. Right. And so,
Oh, wow.
so
Yeah.
yeah, I mean, there's that too. Well, I mean, there's just some people who are also they're really there's hard time with money or they're just really miserly. Like they're not spending
Yeah.
a dollar on anything. I've worked with a very well-off patient population where they lost their business and they one person made one of my colleagues fill out a prior authorization so they didn't have to pay their $5 copay on a medication. And
Uh,
this is somebody who makes well into the triple figures. And
well,
we were just like, "I'll just give you the money." Like, it's like, "I'll just give it to you. Here, let me just pay for it," right? And that's what you wanna do but then it
I mean,
just
when I
suffers it.
see, I have to see a doctor like every 6 months for checkup, quick checkup. It's like not even 2 minutes, right?
I very
And
rarely get those. I
and
very
it's
rarely get somebody who's straightforward.
oh, mine is like so quick, but it costs me, like $15 to $30 in parking, and then $90 copay, and
Well, that's a
then
structure of your insurance, but
yeah,
also
an
it depends on the
hour.
nature of what you're doing. I know what you're talking about, and that's a
Uh-huh.
specialist.
Yeah, and it's like an
And
hour. It's like
but
3 hours of my day for like a 2-minute quick.
yeah,
And I'm just
because
like,
but it's
ugh.
2 minutes and quick because you've been very fortunate and are doing okay.
Uh-huh.
Can you imagine if you were not? It would
But
no
I,
longer be a 2 visit.
but does that mean like I still have 15 to 20 minutes? I mean, I mean, I get it if I do,
Um,
and I'm
it depends on
conscious
the
because of
structure. It
because of
depends
you
on the
guys. This I'm more conscious, but how do we let people
it
know?
depends on your doctor's schedule. Like,
Uh-huh.
I don't know if your specialist is seeing patients every 15 minutes or if they're scheduling them every 5 minutes with double booking. I mean, that absolutely does
Yeah.
happen. I
Uh-huh.
used to when I was a student, I had spent time with a cardiologist, in one of my rotations, and I could not believe at the speed at which this person blew through the patients. Like, I was standing there I felt like I was just in a tornado. I was just like, "What?" I mean, this person was seeing, like, probably 30 patients in the morning and 30 patients in the evening or in the afternoon,
Wow.
I should say, and they were this was a very nice, private practice,
Uh-huh.
and, um, and these patients are elderly with, like they have heart disease.
Yeah.
But, it was interesting because I'd stand there and they'd be like, "Oh, yeah, so any chest pains, anything? No? Okay, great. Nice to see you. Okay, bye." And then run out the door to the next one. And I'm like, "But what if they say yes? What are you gonna do then?"
Right? Like
Yeah,
my
I think a lot of the specialists, though, just to maybe defend us a little bit,
okay.
we're really looking for just certain problems, and we have maybe about 15 to 20 issues that we deal with, and we know how to solve those problems. So we just need a couple of, answers to just very directed questions, and we know the direction that we need to go and what we need to do,
Mhm.
because most of the problems are very similar. And a lot of times, just from what my medical assistant will write down as the patient's chief complaint, I already know what I'm going to do. And I feel like maybe 75% of the time, I don't even need to go into the room to see the patient. I've already made a plan. I've already made a diagnosis. I've already done it, because they're very there are very few things
They're
that,
not
as a
rare.
specialist, that we deal with.
Uh-huh. Uh-huh.
So, a patient comes in, okay, say like I see like a 17-year-old patient, and I'll see like in there, the patient will say, patient's complaining that her periods are irregular. They come once every 3 months, something like that.
Mhm.
I already know what I'm doing. Um, Dr. Foz, like I already know what you're doing when you hear that. I know that she needs birth control pills.
Oh, yeah. I mean,
I know she's going
yeah,
to need
th
blood
there's
work.
some things that are gonna
Right.
happen that are
Yeah.
just really
So I know.
standard. Yeah.
Right. So I know I'm going to see that I'm going to go order some blood work on this patient. I'm going to ask her if she's having, pain or any kind of cramping symptoms. Maybe I'm going to order an ultrasound. And then I'm going to tell her, you know what, at age 17 with irregular periods, you need birth control pills. So I already know before I go into the room. And if I can control and run the interview, then I can ask her my 5 to 8 questions, and then I'll let her know what I think needs to be done: blood work, ultrasound, birth control pills. If she's amenable, she'll just agree, and we'll go over the directions and risks and everything. And then we're done. And I could probably do that in 8 minutes,
Wow. Wow.
That's true,
you
and then
know?
also some
Yeah.
things with specialists, the difference between primary care and specialists is, like, I might be getting something at the first introduction of it, and it's a whole bigger discussion. So, like, somebody comes in and they have chest pain, that could be one of 100 things, of which, there's 5 or 6 that are extremely dangerous. And so, the cardiologist that I was referring to earlier, they already have established heart disease. So if they're having chest pain, the cardiologist knows, okay, we need to increase this medication and do this and get them in for whatever test. So in some ways, it is a little bit more kind of like the diagnosis is established.
Okay. So outside of like the Q&A that you guys do and kind of a quick checkup, what things do you do that would take much longer? Like popping a bump or I don't know, cutting.
Well, you mean like bedside procedures?
Yeah, procedure. Yeah.
Yeah.
Oh,
Well, I
well,
mean,
I mean,
yeah.
I do a lot of procedures. I mean, I do like endometrial biopsies, which is like uterine biopsies. I do cervical biopsies. I do vulvar biopsies. I place IUDs. I remove IUDs. So those all take longer to do. Those I can't do in, 2 minutes. So
Uh-huh.
those take a little bit longer to do. But then
They're typically planned.
some people come in with complicated situations, like postmenopausal bleeding. I need to ask a little bit more questions. I already know, like again, if the patient is 60 years old and her complaint is bleeding, I already know what I'm going to do with this patient. She needs blood work, she needs an ultrasound, she needs an endometrial biopsy to be done, but I need to talk to her a little bit more about her history. So I need to ask probably more questions, because I want to know about her family history, her mother's history, when this bleeding started, how long she's been menopausal, etc. So that takes maybe a little bit more time. And then sometimes people come in with few problems, like they have postmenopausal bleeding, then they have urinary stress incontinence, then they also are having a vaginal discharge, then they're also having pelvic pain. So then I have to kind of address each one of these things. But for the most part, we see a lot of the same problems over and over again, and we know how to treat them, and it gets, more of a sort of routine. So a lot of times with these specialists, like if you're referring, to endocrinology for hypothyroid, they already know, okay, the patient's here for hypothyroid, her TSH was, elevated. They already know, okay, I need to run these tests on it and I'm going to give her these medications and we're going to do this. So they don't, because they see that hypothyroid patient 7 or 8 times a day for years, so they know how to do it. You know, Primary care is very different because primary care, you're dealing with all the issues that specialists see. So
And
you
the
might be
first presentation.
exactly.
And it's like,
And
yeah.
oftentimes they're the ones diagnosing it because the patient will come in and say, I've just been feeling really tired and sluggish, and I'm having some hair loss and some weight gain and all these other symptoms. And the primary care doctor has to hear these symptoms, do the exam, and put together, this might be hypothyroidism. Let me send you for some labs. And then they get the labs back, and it's like, yes, you do look like you have hypothyroid. So I'm going to start you on some medications, and then maybe those medications don't work and now they need to go to a specialist. But the primary care person has to see the first presentation, order the first test, make the diagnosis, and listen to them all, because not maybe it's not hypothyroid, maybe it's something else. They've got to put together the entire clinical picture of what it might be and figure out which road are we going down. Is this a menopause thing because the patient's 50? If it's a menopause thing, then maybe I'll send her to gyne, but maybe it's a hypothyroid thing, then I have to send her to endocrine. Oh, but then she's also short of breath, so is this a pulmonary thing? So they have to kind of put the picture together so that when they send
Wow.
them to the specialist, then we can deal with it, because then they've sort of weeded it out and narrowed it down. So now when she comes to me already kind of talking about, oh, I have menopause questions and symptoms, then I can go into my, okay, menopause is a normal thing that happens to every single woman at this age, blah, 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 and just give her my spiel, and I don't really have to do as much investigation as the PCP does.
Well, in some ways, it does get a little bit frustrating because I do try to hand patients over like fully worked up, as
Yeah.
opposed to just handing them over like, oh, you have postmenopausal bleeding, just go see Dr. Ray, right? It's
Yeah.
like, well,
Yeah.
I'm going to get the ultrasound. I'm going to make sure your pap is up to date. I'm going to,
Yeah.
make sure you don't have like something obvious like a cervical polyp in the way. And
Yeah.
so I'm going to like do those things, to try to. So this way, when they show up at Dr. Ray's office, like Dr. Ray just needs to do this as opposed to
Yeah.
having to start from the beginning. And it gets really difficult too with
And
some.
I'm going to interject and say you are one of the very few PCPs who actually do that, because most of them just hear oh, I have postmenopausal bleeding, and they're like, gynecology.
Wow.
And a lot of times,
Really?
a lot of times they come in and then I talk to them, and then I'm doing my exam and they've got a polyp, or they've got an aborting fibroid, or they've got something. And I'll ask, oh, did your PCP do an exam? Did they tell you anything about, a polyp on your cervix? They're like, no, they didn't do anything. And I'm like, okay, well, boom, take the polyp out. Now you're fixed, kind of a thing. So,
Wow.
yeah.
Listen, what I'm hearing from you guys, and I think what our listeners need to learn, is that seeing your doctor is like going to Jiffy Lube. Like
No,
15 minutes.
I don't want to put it that way. You know what?
Okay.
This is what I would like the patients to know. I
Okay.
would just like them to come in and be efficient, like ready to give a presentation. Like when I walk into the room,
Shoot.
look at it as I'm giving a presentation in front of my class and my teachers about what is going on with me. Be clear, be concise, and be efficient. And
Oh
be
my gosh.
prepared for
Can we do
questions.
PowerPoint presentation?
Because
It's like a business
oh,
meeting, people.
yeah, because if you come in and you're just like, oh, yeah, like I don't know when it started, maybe about 3 months ago. But no, it wasn't 3 months ago, because I remember it was happening at Halloween. And then that time it was happening this,
Wow.
because I remember because my daughter came over and she was dressed like a pumpkin. And I was like, oh, you look so cute as a pumpkin and everything. And I remembered that I was having my bleeding at that time because I was going to take her out and do this. But you know what?
Totally what happens.
Maybe it was July 4, because on July 4, when my son came over with my granddaughter, and I remember because she was wearing this really cute outfit, and oh, did you want to see a picture? I have a picture of her. Do you want to see it? And I'm like, what the fuck is happening? Can you please just tell me how many months? My question was, how many months have you had this problem? not show me a picture of your granddaughter.
It's like, I want to see the picture of a granddaughter, but not right now. Can we do that at your next appointment?
So
like,
email
I
me.
want to do that, but just not right this second.
So if you came in and said, hi, doctor, I've been having some bleeding for 5 months now. I stopped my period 2 years ago. And then 5 months ago, I started having bleeding. It's lasting about 3 to 5 days. And that's what's going on. Then that helps me.
Even
and now
if you said,
focus.
I think it started about 5 months ago.
Right.
Around, I mean, I would be good with that.
Right.
5 minutes, 5 seconds, 5 years, 5 weeks, 5
Right.
So
lifetimes.
timeline is important.
Timelines
Okay, we
are
have
so
a hand
important.
raised here.
Yes.
Go on, SJ.
Okay, a couple of things. So what I'm hearing is that you doctors judge us if we don't have our crap together when we come in for our appointment. That's number one. Number two,
Yes.
Number two, sometimes it's human nature to want to give context. So if you're explaining something that's happening to you, sometimes you have to say, well, my Aunt May pointed out that I have a mole. And so I decided at this party that maybe I should see you.
And so see, that's a short bit of context. That's not like a tangential conversation.
All right.
I don't mind that. I'm good at filtering out stuff that is not critical. But it's like, hey, and then, but see, I have to take a little bit of, I hear you on that, Dr. Ray, and yes, in a lot of ways I agree, but I don't want everything that ever happened to you. Like, and I have patients who get like obsessed over details that are not associated with what's happening. And I really have to break those associations. I'm like, look, this is, I understand. I hear your concern that you think this problem is associated with that action, but let me assure you, there is no mechanism that would be the case. I think this is probably coincidental or not related. So let's let that go.
All right. As your tech friend, I think you guys need to come up with a form for the patients to fill out, like on this date. Yeah, it's like a quick form they could write it out so that.
You know what? We do that. Okay, I have been through all of this. Okay, I've been in the game long enough to have seen all these iterations of everything. And what happens is when you have them fill out an intake form and then you go over it with them, totally different answers. And I'm like, what changed in the 10 minutes since you filled out this form?
Well, it has to be an app. It has to be an app
doesn't
on their
matter.
phone.
It doesn't. I do this every day
swipe.
right now. I do. Okay, let me tell you this. I have, whenever I send a portal message to a patient, like, their My Health app kind of stuff, hey, your lab result, your vitamin D is a little bit low. This is what I want you to do. I give you exact written directions. Take vitamin D at this dose for this long, and then take this ongoing maintenance. It's written, it's clear, specifies over the counter versus prescription or whatever it is, right? And then I'll have the patient come back. This just happened to me not very long ago. Come back. I'm like, are you taking this? And they're like, no, I'm taking this. I'm like, well, did you not see my message? They're like, and I'm like, yeah, you did, because, all these, I can tell when you looked at something. I know you saw it. And then they're just like, oh, I just didn't read what you write. And I'm like, okay.
Yeah.
Like,
I think you need to DM them on
don't.
Instagram.
So that happened. And then there's the other
when I
things
used
too.
to leave, when we used to have voicemails, and I would leave a voicemail with all the instructions, and then they'd call back like 2 seconds later and be like, oh, you called me? I'm like, oh, I left a voicemail. Did you read it? And they're like, no. I mean, did you listen to it? They're like, no. I'm like, oh, now I got to repeat my entire instructions.
Well, you know what? For our listeners and for the people that's here, I have to give a testimonial. I saw my doctor, and Dr. Foz wrote out like my status, and I think it was the best doctor appointment I've ever had, when the nurse or medical assistant, like I said, here's my paper, here's what I need to here's what's going on with me. And then the doctor came, she just read it, it's in and out. She was just so happy. She's just like,
well, because I know what your doctor needed to know.
Yeah.
And so it was like, these are the things that need to happen, and this is why, and that's it. Like,
wow, that's a gig. That's like that's an app, where someone can just like, let me put together.
I could be your pre-doctor's appointment coach.
Yeah.
But
that sounds like the worst.
In all earnestness, in all earnestness, we're not judging the patients at all. We just want to make the best time of what we have. So if I only have, a few minutes or something with them, then I want to make the best use of this time. And so if they're going off on tangents, if we're not getting the information, then it's not the best use of time. So we have to do a lot of redirecting. So what I would just say for patients is just go into the doctor's office and just be efficient about what your problem is. Write it down. These are the 3 things I want to talk to you about, and just tell them at the beginning. I want to talk to you about my foot issue, my back issue, and my headaches, whatever it is. And then the doctor can be like, okay, let's address those questions. And we just need to be time efficient. That's what it is.
Well, and also my foot pain and my back pain and my headaches can require, some exam, and it can also require, a lot of it depends on the status of the patient. Like if I know you, I've taken your medical history, I've gotten to know, I know that you don't abuse drugs or shoot up. Like, back pain in somebody who, has been incarcerated several times and uses IV drugs is a lot different than back pain in a senior executive at age 60 who works out regularly.
Right.
And so but if I don't know which one of those you are because I just met you, I'm not going to know. I don't know if I'm necessarily going to be able to figure out your back pain and your headaches and your foot pain in the next 5 minutes.
Right.
Wow.
But that doesn't mean I don't care about them. It's just that I can't do them all right now. And yes, I will judge you if you can't tell a story. I'm not judging what you're there for or like any of that stuff, but I'm like, "Oh my God, it's like veterinary medicine. I can't get a story out of you to save my life."
Yeah, presentation, as Dr. Ray said, huh?
Yeah.
That's so interesting. Get your timelines. I know when I would see my OB-GYN, it's like, when was the last time you had your period? I'm like, I don't know.
Yeah. That's exactly. And then we have to sit there for 5 minutes trying to help you figure it out, because I need to know, like, are you cycling regularly? Are you possibly pregnant? Are we having a problem with your periods? Like, just tell me when it is, or that it was like that you didn't miss any or something,
And I get it that people get nervous, like I totally get
Yeah.
it, but like there's a screening tool that's often done as part of like check-ins, like they have to do like a mental health screening and all this stuff. And sometimes the answers you get are like completely discordant. You're like, "Wait a minute." Or what the medical assistant just told me, like my intelligent, well-meaning, well-spoken medical assistant will say, "This patient is complaining of this." And I'll go in there and it's like, and they said there's none of this or none of that, or, and I'll go in there and it's like the total opposite. And people just get like really nervous. And then you're like, "Oh my God, I can't."
That's
Like
me. That's me.
I have to.
Just want in and out. Just don't tell me anything.
Well, but see, the thing is like, I think, see, why are we so nervous? That's part of it. Like, is it just because you have to talk to somebody that you don't really know well? Because that is a real problem with Gen Z. I actually have to talk to you. I
Really?
can't sit here and text you this. Okay, that's a problem. And then also it's like, hey, like you're not allowing me, like there's no trust, It's like if you can't, I'm trying to make this a safe space for you. It is not, and if you can't meet me halfway, then it's on you.
I get nervous because the doctor will tell me things that I don't understand, like words that I'm like, huh? And I feel like I'm in
But tell us
my
that. Be like,
biology
okay, I
class.
don't, just be like, hey, I don't really understand what you're trying to say. And
Yeah,
we
let
can
let
dial
us
it
know,
back.
because if we sometimes use more complicated phrasing or words, then you
Yeah.
just need to just say, what does that mean? Or could you say that again, or something, so that we can, explain it to you more
And I will break
simpler.
it down. I try to use
Oh,
simpler
wow.
terms. I don't try
Okay.
to use, all these crazy medical terms that are hard for somebody to understand. But,
Okay.
everybody has different, I mean, some people
Yeah.
are not really well educated or have very little experience in certain things.
Or
And that is what,
short-term
that's the
short-term
general
memory.
public.
Okay, you know
There's a
what?
whole mess of hands.
I mean, there's a lot of hands here, and
How
Dr.
did
Ray
people
has to.
get here?
I know, right? Dr. Ray has to
We
get going. How are you doing with time?
I'm good. I'll just stick on and listen as I can and interject as I can.
Okay, that's
Okay.
how it is. Chill. You've got your hand raised.
Yeah.
Oh, great. She leaves it to me.
Specifically-
Thanks a lot, Dr. Ray.
I'm like, why can't you diagnose me in 5 minutes? I'm just kidding.
You're the doctor of everything, remember?
That's right. That's right.
Well,
Humans and animals.
You're specifically
and
talking
apparently
about
okay,
pest
chill.
control now too.
Okay, chill. Go on.
Gen Z people not maybe expressing themselves articulately, it could have something to do with previous experience with doctors. I don't think it's necessarily.
Oh, have you had that kind of patient where they may have,
I'm
you know?
actually being facetious about that. Like, I
Uh-huh.
don't
Oh, a
really.
negative
I think
experience.
it's a huge thing, and also, it's interesting how when you're in the office, you can't say anything to me, but you will send me a long, complicated message at other
Uh.
times.
Or like my dad, my dad would complain about all these things, and then when he sees the doctor goes, How are you doing?" He goes, "I'm okay."
Right. And the men do that.
Yeah,
But
right.
I think it's easier to do it away from like on not face to face, where you can really express yourself. Because a doctor's office is kind of intimidating for a lot of people.
Yeah,
It may be
unfortunately,
something
that's
a
where the business
parent
has to
went
happen, though.
through,
That's true.
not
Unfortunately, that's
them.
where it has to happen.
Well, I know. I mean, I'm
Yeah.
just saying the reasons that it may be that way, and then once you like get a level of trust, maybe it changes. But initially, there's so many barriers. It could have been a family member that was mistreated. Anything, could have happened that they found negative. You've seen post about, oh, my cousin went to the hospital and they treated her terribly and acted like she was a drug addict, and so those things. And so I think a lot of people, especially with the internet now, they read those things. So there's a basic distrust of medical professionals more than there used to be.
How do we
Yes,
how
and
do you
I
spell
find
that?
that extremely insulting. I'm just gonna say that. Like, I
Uh-huh.
get it. I'm not trying to minimize somebody else's terrible experiences, but I didn't do those things to you. I'm doing everything I can to make this as equitable as possible. I am going to put my sanity behind your health.
Well,
Yeah,
And,
but
like,
they
I
don't.
will lose my mind trying to take care of you,
you
but when
sound
you
like
come at me
you sound like the
already
second wife.
distrustful,
Yeah,
then
they
it's
don't know
like,
you
whatever.
though. See, and so you can't expect them to feel that way or know that about you when they're really just meeting you. I mean, I get it, but yeah,
How do we overcome that? Because that's
I don't think
There isn't
you
one, it's
can. Not in
systemic.
one visit. I mean, not especially not in the first visit.
I guess we
You
could
have
just you could just
to.
yeah, you could just tell them to listen to this podcast.
Oh, wow. I don't know if the doctors would want all that going on. Go ahead, Sandra.
All right, Sandra, go on.
If they listen to this podcast, it might make it worse. um, so when people are already have a certain amount of fear, like if they've already doom scrolled, they looked up all their symptoms, and they went down that rabbit hole, they're already going to be nervous when they finally get to that appointment that took about 3 months to book. And so when that happens, do you guys notice is what is it? It's called white coat syndrome. Is that an actual thing?
Oh, they don't even wear white coats anymore.
Well, yes. I mean, it's there's white coat hypertension. That's a real thing. Like, a doctor's office is a stressful environment in any circumstance, and I'm not even going to talk about hospital or acute care settings. That's a whole different ball
Uh-huh.
game. But yeah, I mean, the thing is it's frustrating on everybody's part. I'm sharing my frustrations on it.
Uh-huh.
I've already spent enough of my career understanding and listening to everybody else's frustrations. But if you understand some of my frustrations, maybe we can make this move a little easier.
I mean, in a way, this is good to hear the doctor's frustration because we don't hear that. We don't. Most people don't really get to hear that side.
Do
You
you
know,
express that to your patients though when you meet them? Do you talk about that at that level, maybe to
can you?
break
Uh-huh.
the ice or anything like
It
that?
depends on the nature of the interaction.
Oh,
Uh,
You
okay.
know what I mean? It depends on, like, it's like, hey, I get it. I am just as angry that you and I have 10 minutes together as well. I don't think that's fair to
Yeah.
you, and it's absolutely not fair to me. But this is what we're working with.
mm. Could you
If
have
you
like
work with me, I will get you there. But
could you
I,
have
you know,
like music playing, and then when the music ends, we got we gotta end this
like the
like the Emmys or
like the
Oscars.
Jeopardy song.
Yeah. Play some music and go, okay, we got that music. And yeah,
You know,
that's an interesting
my
that,
doctors don't adhere to like the 10-minute visit, and I see a lot of doctors, and I know they have a lot of patients. The waiting room is never packed when I go to most of them except for one. But they don't rush me if I have questions. They don't, I feel like as long as I'm talking, they're going to listen. And if the next person has to wait, and I'm sure the next person feels that way too. Like if the next person has to wait, then they wait. And so when they are late, then later than usual to seeing me, I don't have a problem with it because I know that that's how they are.
Yeah, I
I,
think
Yes, and
you're
that's
talking like
ideal. That's ideal, where you
yeah,
yeah,
have a situation where it's like, "Hey, you know what? I'm sorry to keep you waiting. I know that your appointment was supposed to start a half an hour ago. I apologize,
right,
but somebody had some serious issues and I had to
right.
take a little extra time with them, and I will take it with you." However, the system doesn't allow me to do that.
I understand that. That's the
That's where the
problem.
problem is. I
Right.
can't do that because now my boss is like, "Hey, you're 20 minutes behind on every appointment. If you keep this up, we're going to fire you."
Right. And if a patient needs extra time, like, sometimes I deal with pregnancy loss and I'm not going to just be like, okay, my time's up. Sorry, you're,
Right,
lost your pregnancy. Bye.
Oh yeah,
So I need to take the time that I need to take with them. And then that does put us behind. And so it's nice that some people are very considerate and know that, things don't always run on time in an office because who knows what just happened in the room before me.
right.
So it's always appreciative. But yeah, when I'm behind, I do, kind of tell the patient, sorry, I'm running a little bit late today. I had some complicated patients earlier and that put me behind. And most of my patients, I would say 99% of my patients are very fine with it.
They,
They don't complain. They don't say anything. They just understand it and they're cool with it because they know that, I'm going to give them the time that they need, so
right.
just
it's
whatever
the
we're
ones
going to
that are
talk
not.
about, it's fine. Yeah.
yeah.
It's the ones
But
that are not. They're like, "I've been waiting." And you're like, "Okay, you've been waiting 15 minutes." Like,
But
but
then,
you
like you
know,
say,
but
it's
I
the
think
company
you
that has a
guys
problem with it. It's not the patients. It's the
yeah,
people you work for,
yeah,
who demand a certain turnover time. And if you're
yeah.
consistently late, yeah, then it comes to their attention and they talk to you about it, and that sucks.
Yeah, I think you guys also cleared up something, to me. And that's uh a specialist versus a PCP. And I think with chill, what you're probably dealing with are specialists. I think I'm gonna guess, and
A lot of
that
them are. A lot
you
of
have
them are. I only have
right,
one PCP, but
right. So
she's the same way. But in general, all of them except for one, and it's a busy clinic because it's a
yeah,
heme clinic. It's a
yeah, and
lot of people.
I get the frustration because the doctors, you guys can't let the patients feel like you're rushing them, but really what's going it's kind of like I guess it's like a restaurant, like we don't know that they want to clear our table so they could
totally.
move, right? But we're
You
just
don't want to
enjoying
put that
ourselves.
pressure on. I mean, you don't want
Yeah.
that's not nice. Nobody wants to do that.
Yeah.
But somebody's got to move this along or we're going to sit here all day and it's not going to work.
Yeah. Yeah, it's something that I didn't know about restaurants either.
And
You know.
there are a lot of people who are just selfish. They're just selfish. Like, I know that you have other patients waiting, but I really want to talk about my toenail fungus right now.
Oh,
And you're like, "Okay."
at the end of the
At the end of the
uh
appointment, or it's like, "Hey, we're already 5 minutes after your appointment ended." "Yeah, I know, but I need this done now."
mm, wow. What do you say to that? You just have to do it.
It depends on the situation.
Mm,
And
that's
sometimes I'll be
tough.
like, "Look, okay, let me see if we can get let me snip a piece of this nail and let's see if we can send it for culture and then we can talk about more." Like I try to do something.
Uh-huh.
Or, "Hey, why don't you try this? And if it doesn't get better," or sometimes it's like, "You know what? Let me just refer you to a dermatologist." Like sometimes that's where you do have to just like punt it to the specialist. I don't call that I consider that delegation.
Uh-huh.
It's like there's too many things, and so I need to delegate it to somebody who can help me out.
And I hear your frustration, Dr. Foz, because Dr. Ray is always telling me you're like a little bit like unique. You really go out of your way and you do so much for your patients.
You
And
guys
I don't
don't know that.
uh, I do. And so I hear your frustration, and
That's just because you guys are my supportive friends.
oh, so I'll sit with you next time and watch you punt.
So, I mean, there's like ways around stuff. Like sometimes you have to just, but it's just hard because it's difficult on both ends. And part of why things don't always go as well is systems issues and how that impacts how I have to move in something.
Uh-huh. Wow. Have you ever had I'm gonna switch this thing a bit. Have you ever had a patient where, all right, it's going 15 minutes, blah, 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 but you now have to do some procedure that you like something weird that you didn't expect, like you found something weird?
Yeah, sometimes if it's really serious, then you say, "Hey, this can't wait, and I have 5 people who are waiting for me right now, so I'm gonna have to send you to the emergency room."
Oh,
Yeah, sometimes you have to do that, or let me say, I need a lab on this right this second, so we're gonna have to go to urgent care for that. So sometimes you do have to punt out, or I'm gonna send you to a specialist. Let's see if we can make that expedited, which can be difficult in some specialties. Like there are some specialties that you can get people into really quickly, and there are
uh-huh.
some specialties where it's like pulling teeth, just because of impacted access.
All right. So, and I'm gonna ask another follow-up to that. Seeing a PCP, your primary, versus going to urgent care,
Mhm.
what's the difference? PCP,
Urgent
someone that
care
knows
is
you?
for something that is urgent, and the definition of urgent is kind of variable.
Okay.
Urgent can sometimes mean, well, this isn't really an urgent medical problem as of this second, but it's urgent because I have business travel that's taking me internationally tomorrow, and if it gets worse while I'm traveling, maybe that's not a great choice. Like, stuff like that. Like, so it can be sort of situationally urgent, but
Mhm.
often it's for things that, like, I've got this huge laceration, I cut myself with whatever, and I can't repair something that big in an office setting on the fly. So now I have to send you to urgent care. Or, you have I'm just trying to think of typical examples. Sometimes, well, it depends also on what the urgent care can
The
do. Some
flu,
urgent
a
cares are
medical,
some
Uh-huh.
urgent cares are, like, not really much different than a doctor with a stethoscope and a few rapid tests, right? Like, not a big deal. Some urgent cares are what I call higher order or higher functioning urgent cares, which have access to, like, stat labs and, stat imaging, so they can get stuff done, like, right now. So if you have belly pain that's concerning for appendicitis, but you don't look sick otherwise, and you just need a CT scan, then you can sometimes get that done at an urgent care depending on the nature of that urgent care.
Wait, pause.
Yeah.
Um, so I could look up an urgent care and see if they have that you call it stat lab?
Well, yeah, I mean, it's like, do they have access to labs? Like, I've worked urgent care, and some urgent
Uh-huh.
cares that I've worked with, like, they don't have anything besides the labs that I have in a primary care office, which is like, I have to order the lab, and you have to go to the lab, and you have to have the lab drawn, and then I have to have a report. So that is not gonna happen I'm not gonna get a result on you in 2 hours.
Oh, I didn't know that I could look that up and kind of
Well,
s
that depends on the urgent care you should ask. Sometimes
yeah.
you don't, and sometimes urgent care is like an overflow for primary care. It's like if you have, like, you might think you might have, for example, like strep throat, and your doctor does not have any openings on their schedule to see you. They're fully booked, and it will take
Right.
3 weeks to get an appointment. Then
Yeah.
you can go to urgent care to handle that because it's an episodic, single, I need to address this now, as opposed to waiting for an available appointment, or it's something that's not so severe that that the emergency room has to be involved.
I used an urgent care a sinus infection, and it was telehealth. They even did telehealth, prescribed me some antibiotics, and I was all better. But a lot of them have you can look up they offer. Times they're open.
Yeah, so
Um,
telehealth, at what point is something telehealth, urgent care, call your PCP, go to CVS? What's kind of a
well, for me, a sinus and I, I guess me being a medical professional and describing and can describe my symptoms and in a rational way. For me, the telehealth option was perfect because you know I got that. They gave me the antibiotics, pick them up, biff, bam, boom. It was all done. But maybe for a patient who's not as articulate, they might have a problem, or they may tell you to come in or something. But it was an option. I didn't, you
So
know,
if a
I
doctor doesn't need to touch you, you think telehealth is okay?
yeah, for something minor, like if you got the flu, coughing, sneezing, you got a little fever, you feel aches and pains, you describe what you're feeling, and I guess they'll let you know if it's suitable for them to diagnose you over the you know they look at you on video. You're not just on the phone, of course. You're on a video,
There's a lot of
so
things that are not appropriate for virtual calls or virtual care
yeah,
that people don't fully understand.
Okay, like
They
what?
think that everything,
right.
well, if you have an earache, I don't think that's appropriate for virtual
No.
care
Okay. Sinus
because I can't look in
infection.
your ear.
Okay. But don't you have to look up my
Sinus,
nose if I have a
I
sinus
mean,
infection?
ideally, but you don't necessarily have to. That may not change anything. Like I would say a diagnosis where there's nothing critical and it like, if you have a cough, let's say you have a cough and you had a fever and you're still coughing and you're feeling more tired, like ideally you come in so I can listen to your lungs. Like what you sound like on your exam is really going to be important in how I assess what we're going to do with you. If you're only going to do it through telehealth, then I have to make some assumptions. And
But
so
then if
there,
you do telehealth and
it's
don't
not
get
always
better,
appropriate.
they tell
Okay.
you. I guess they would tell you you need to follow up. I mean, that's what I would feel like if I give you this 7 days of antibiotics and you don't feel better or you get worse. You need to come in or see a doctor or whatever. But I get what you're saying, Dr. Foz.
Okay. Like what about like UTI? Is that telehealth?
That
Is
can
that
be that
telehealth
can be
quality?
that can be handled, I'm gonna say this, kids different, males different. If they're not critically ill, that can be handled through telehealth, but for the average adult woman, yes, that can start through telehealth. Now, the frustrating thing comes up with that is people think, "Well, they did telehealth last time, why can't I do it this time?" And it's like, "Hey, if this
Mm.
is your 3rd UTI in 3 months, I need a urine culture on you, or if you're telling me that you have back pain and fever, I'm not gonna handle that through telehealth." And so it kinda depends on the situation.
Okay, then I'll circle this around from this topic, and we'll end soon. Is does telehealth have a timer?
What do you mean?
Do you know? Like, okay, we've got like 15 minutes to talk. Does it have
Yes,
a
well,
time?
it depends on the system in which you're getting it from.
Uh huh.
So you have like, I do telemedicine as part of my practice, and so you have an appointment slot, and that's always really fun too, because when you can't connect with the patient,
Uh huh.
so then you're like chasing them all over the world, and then all of a sudden you find them. It's like, well, we had a 20-minute visit, but now it's 10 because you were too busy washing your baby and you couldn't pick up your call or be you're in front of your
Connect.
computer or whatever the
Uh huh.
situation is. And then there are some that are like, chat medicine. I think Amazon offers some of that stuff where you can just chat with the doctor or some of these services. I don't know if I
Oh
don't do them, so
wow.
I can tell like, well,
Uh huh.
you can just do like texting, like, hey, I have this, and then and
Oh
so I think
wow.
that's what a lot of like the online services do. I think that's how like
You,
Row and all of those operate. Like you just sign up and they just ask you a few things, and then that's it.
oh, you probably get a doctor from the Philippines, and they'll say, "Sir, ma'am, is that what's wrong?" Okay. All right. All right. I'll end there. All
Is your
right.
practice in the Philippines, Doctor? I mean, California, Doctor Foz.
Oh,
Beg your
we
pardon?
can.
Are you in California?
I'm not in California, but I
Okay.
am, yeah.
Well, that ends this quick, good round, this episode. Wow. So if you're listening, um, prepare for your meeting with your doctor. Dr. Ray said, ideally have a presentation ready. I think write it down, put it on your phone.
PowerPoint.
I think you need a PowerPoint and
Have
like,
a point.
photos,
Well, just be
but
able to kind of briefly summarize what your concerns are. That's it.
Yeah, I hear you.
That's
there
it.
you go.
Just try to the best of your ability. That's all we would
Yeah.
ever ask.
And be conscious of, the time, and the doctors don't want to really push you out, but it's really not under their control. So any closing? I know Dr. Ray had to jump on a train. Dr. Foz, any closing remarks?
Have a great week, everyone.
Have a good week.